What is the specific area of Meditech that you are implementing?
The module of Meditech that we implemented was the lab module and the pathology module, microbiology module, as well as the blood bank or transfusion module.
What has changed since the implementation of Meditech?
So prior to our Meditech implementation, we did not have a blood bank module available for our patients in the hospital. Prior to that, we had a paper-based look-back system, which was arduous, as well as there was a lot of transcription that had to be that was involved in that particular method. With the new method, there are hooks in place to, for example, not allow people to be dispensing blood or the wrong blood type of blood to the wrong patient. So that is a real patient safety, benefit to our patients with the implementation of the blood bank module.
How has the implementation of Meditech directly affected patient care?
A few things that have changed in the hospital with the implementation of Meditech was the implementation of nurse collection. What we did was we went from a fairly antiquated and lab information system where nursing was actually implementing into the lab system to the Meditech system where nurse collects specimens, for example, swabs, urine specimens. Those things are actually collected by nursing now, so there is a little bit more keyboard time for nursing and interfacing with the actual information system itself. Those are some of the benefits for the lab. I think some of the nursing departments feel that they've been, overworked or have to have a little bit more time with the information, less time with patients. Going forward with the implementation of the hospital information for Meditech and nurse documentation, I think that that's going to be something that's going to be driving them in that direction anyway. So they're going to be more familiar with the system, and their hospital information or implementation will probably be a little bit easier with the familiarity with Meditech as a product itself.
Do you find that Meditech offered you good support in the process of implementation of their product?
Meditech as a company basically provides an individual or individuals, depending on the size of the project, for the implementation that is dedicated to that particular project for the life of the project. So for example, in our case, we had to go to Boston, for example, for training for a week, as well as them coming to our site for 4 weeks of implementation help. They had a technical specialist that came to help us with our implementation, as well as teaching us on how the actual software works, help us build the dictionary so that we could implement the actual software, as well as be there for the go live or conversion date. So that's one of the things that they supply, as well as after the conversion or go live date, they also provide technical assistance through their own information help desk, as well as they have a knowledge base that they offer to all of their customers that they can access their own information if they have any issues with their dictionaries.
What were some problems you encountered with the implementation of Meditech?
There are probably a couple of things that this implementation had a few wrinkles with. One of them was printing, and since we are still printing paper reports for our charts in our hospital, it can sometimes be a bit of a burden. We had some issues with reports going to wrong places. Since we have a submerged admission module, there is also a bit of an issue with a broken record, considering that we have people being admitted and discharged, and so the system really doesn't know where to print some of these reports. That was one of the issues. With the new version, though, I think of 6.0 with Meditech, a Windows version which is more friendly to folks and how they're used to looking at computers. For example, with their household computers, they'll be more familiar with using a lot of this software going forward. We find that the younger people coming into healthcare also have an easier familiarity and an easier training period when it comes to using software compared to some of the folks my age and older.
Your hospital has also adopted the pharmacy module from Meditech. Are they compatible?
the integration between the lab module and the pharmacy module can occur in a couple of different ways. It's directional for both modules. So what ends up happening would be for example, in the pharmacy, you would like to know what a drug level would be, whether it be a antibiotic level, aminoglycoside, anti-epileptic drugs such as valproic acid. They can pull that information from the testing done in the lab. Conversely, or on the other side, the lab can actually pull information from the pharmacy module for antibiotics. For example, if someone has a culture and sensitivity that has to be done on a urine, I think the lab would like to know in the microbiology department in that module what the I guess antibiotic would be that the physician's already prescribed or the pharmacy has dispensed.